talk about signs and symptoms to look for RSV. Hi, I'm Devin. I'm a pediatric nurse practitioner and I love sharing and educating about pediatric things, also sharing fun things about motherhood and a little bit of my more natural way of approaching healthcare or my more natural way of approaching life with some low tox swaps. So if those are things that interest you, I would love for you to follow along. And today we're based on the signs and symptoms of RSV. And I did do a video before on what I would keep on hand to help treat RSV at home. So you can go back to my page and look at that if that is something that interests you. But basically, RSV comes down to what is RSV. It is a virus that looks very similar to just other common cold or viral symptoms, which can make it hard to determine or actually label it as RSV. So lots of times you'll be told that this most likely is RSV, or another term that we often will use is something called bronchiolitis. Typically, we don't test for RSV unless your child is very, very sick to the point where they need hospitalization. You have a complex medical history where it might be important for you to know that, or other sick contents, like other sick people that you were around. But otherwise, we typically don't test for RSV because it's not going to change our management. It is a virus, and there's not a medication that we would give your child that's going to make it go away. Therefore, it's not going to be worth it to put you through testing and also the medical costs of those swabs. The things to look for, or the biggest things about RSV, is that it can cause very heavy breathing, which can cause your child to look very bad and often not want to eat, which can lead to dehydration. So the biggest things to look for are your baby or child is dehydration, and then how they're breathing and their respiratory status. So the first things to look for in that are, how do they look, how are they appearing, how are they interacting? When it comes to dehydration, things to look for: are they producing tears if they're at that age of producing tears? What color is their skin? How are they looking as far as their undertone? Do they look pale? Are they eating? If they're nursing, are they nursing the same? As a mom, if you're nursing, do you feel full? Do you feel like they are emptying you? Are they taking their full bottles? Are they not taking their full bottles? How often do they want to eat? Are they vomiting with that? Are they having wet diapers? These are all the questions that I will ask, all the things that you can think about, and often the things that I will tell parents. So I often say, at least a wet diaper every 8 hours. Are they producing tears? Are they at least waking up to have some sort of feed and wanting to eat? They may want to eat less often and more frequently. And I highly, highly, highly recommend suctioning before eating and sleeping, as it will really